Recording in progress.
Thank you, Juliana. And good morning, everyone. My name is Galina Tokmako, and I am an analyst with CalFresh ABOT policy team. And we'll transition to our CalFresh Work Registration 101 presentation. On our agenda today, we have the overview of work registration policy, which includes topics like exemption from work registration, good cause, disqualifications, county responsibilities, and how work registration ties into ABOT policy. So, starting with some background information. Federal and state regulations establish the general work provisions for CalFresh. Now, these provisions are governed by U.S. Department of Agriculture, Food and Nutrition Service, the FNS, and are implemented by the California Department of Social Services, the CDSS. The work registration is a prerequisite to receiving CalFresh and cannot be waived by the county or the state, and requires non-exempt individuals to register for work. Let's define work registrants. Work registrants are individuals who are required to register for work as a condition of CalFresh eligibility. And these individuals are ages 16 through 59, working less than 30 hours per week, or those who do not qualify for an exemption from work registration. These work registrants must participate in CalFresh Employment and Training Program, ENT, if assigned by the county. Must provide information about employment status and availability for work. Must follow up with employers when referred by the county. Must accept suitable job offers and not quit a job of 30 hours or more per week, or reduce hours below 30 hours per week without good cause. Work registration status is determined by the county for all household members at application and recertification. All non-exempt individuals are registered for work by the county during the interview, and therefore no additional action is required from the household. Now let's go over the work registration exemptions. Individuals can be exempt if they are under the age 16 or age 60 and over, attend school or enrolled in ENT program at least half time, physically or mentally unfit for work, complying with welfare to work requirements, caring for a child under the age 6 or an incapacitated person, receiving or applied for unemployment benefits, participating in a drug or alcohol treatment program, employed or self-employed, working at least 30 hours per week, or earning equivalent to $217.50 per week. And now we will define each exemption and provide a bit more context. Starting with the age-based exemption. The individuals are exempt if they are under age 16 or age 60 and older. This also includes individuals who are age 16 or 17 and not the head of the household, or attending school or enrolled in ENT program at least half time. As for verification, this information is mostly known to the county, and also client statement is acceptable unless questionable. And here we included some age-based examples, starting with Jason, who is age 17. He attends high school and lives with his parents. So he is exempt from work registration because he is not the head of the household. And then in contrast, we have Sophia, who is 17 years old, but she lives on her own and applies for CalFresh on her own. She is not attending school, so she is considered a mandatory work registrant unless she can qualify for another work registration exemption, as she is the head of the household. And we included one more example. Mr. Lee is 62 years old and not employed. So based on the age, Mr. Lee is not considered a work registrant and no longer needs to follow the general work rules. However, as we will cover later on, he may still be subject to the ABOD rules unless he qualifies for another work registration exemption, for example, like caring for an incapacitated person. Or if he's not eligible for any of the work registration exemptions, he will need to be screened for ABOD exemption, but more on ABOD later. For physically or mentally unfit for employment exemption, an individual is exempt if they have a disability that is expected to last at least 30 days. It limits their ability to work or participate in employment activities, and they are receiving or seeking appropriate medical care. For verification, it can range from documentary evidence, collateral contacts, can be observable, or any other form of reliable verification can be used. For our examples, we have Sarah, who is 42 years old. She provides a doctor's note stating she cannot work due to a back injury for 6 months. So this exempts her from the work registration due to the verified unfitness for work. And in another example, we have James, who is 50 years old, and he is receiving disability benefits. He is also exempt due to the verification of disability benefits, which confirms his unfitness for work. Next, complying with CalWorks Welfare to Work program, an individual is exempt if they are participating in and meeting CalWorks Welfare to Work requirements as determined by the county, and verification is not required as participation is already known to county. And we have one example here. Linda is 35 years old. She is enrolled in CalWorks Welfare to Work program and is also completing the Welfare to Work assigned activities. So she is considered exempt as she's already participating in the Welfare to Work activities and therefore meets the work requirement through Welfare to Work program. And now for the caregiving exemptions. When caring for the dependent child under the age 6, the child does not need to be part of the CalFresh household or live in the same home. However, only one person can claim this exemption. For verification, this information may be known to county, or a collateral contact may be used to verify the age of the child outside of the home. When caring for an incapacitated person, The care must prevent employment of 30 hours per week, and similarly, the incapacitated person does not need to be part of the CalFresh household or live in the same home. And just to note, being an in-home supportive services IHSS provider alone does not qualify for an exemption unless the provider works at least 30 hours per week or earns $217.50 per week. As for verification, if client statement is questionable, the county may request a doctor's statement demonstrating that the care for an incapacitated person prevents employment of at least 30 hours per week. In some of the examples for caring for children under the age 6, we have David, who is 30 years old. He has a 3-year-old child living with him, and he provides full-time care for this child. So he is considered exempt. We also have Angela, who is 23 years old, but she has her 5-year-old child living with a relative. However, she provides regular care for her child after school and on weekends. So in this case, she is considered exempt from work registration. And caring for incapacitated person examples, we have Lisa, who is 38 years old. She lives with and cares for her elderly mother, who requires daily assistance. And Lisa states that this prevents her from working at least 30 hours per week. So she is eligible for an exemption from work registration. And another example, we have Samuel, who's 37 years of age. He provides care for his disabled sibling, which requires frequent supervision and medical appointments. So he is also unable to keep a job of at least 30 hours per week. In this case, he's also considered exempt from work registration. Another work registration exemption can be granted if individual is receiving unemployment insurance benefits, UIB, or have applied and completed the required work registration as part of the application process. Some of the acceptable verifications include information known to county. If not, then proof of receipt of benefits or proof of a pending application for employment benefits can be submitted. And then when requesting verification, the CW 2200 must be used and individual must be given 10 days to provide documents. For some examples, we have Carlos, who is age 38, and he was recently laid off and is actively receiving unemployment benefits. So as a result, he is considered exempt. And for one more, we have Erica, age 55, who recently lost her job and filed a claim for unemployment benefits. She provided verification, and so she is also exempt from work registration. Next exemption is participation in a drug or alcohol treatment program. The program must be administered by a private, nonprofit organization or institution or a publicly operated community mental health center. And participation must prevent a working 30 hours per week. As for verification, client statement is acceptable unless questionable. And some examples include Alex, who's age 36, is enrolled full-time in a substance abuse treatment program, which prevents employment of 30 hours per week. So he is considered exempt. And another one, we have Brianna, age 29. She participates in daily treatment and counseling sessions, and that also prevents her from keeping an employment of 30 hours per week. So therefore, she is also considered exempt from work registration. Next, the individual may be exempt if employed or self-employed, working 30 hours per week, or earning weekly wages equal to 30 hours at a minimum wage, which is based on the current federal minimum wage of $7.25 multiplied by 30 hours, which equals to $217.50 per week. An acceptable verification can be any payment forms or employer-produced documents that support the individual's employment earnings. And for some examples, we have Sophia, age 27. She works 25 hours per week. However, she does earn wages equal to or greater than $217.50 per week. So she is considered exempt. We also have David, age 45. He is self-employed, doing landscaping. He works 35 hours per week, and therefore he is also exempt from work registration. And our last exemption is being enrolled in a school or training program at least half-time. This exemption continues during school breaks, vacations, and recess. College students must still meet CalFresh student eligibility rules to qualify. And higher education includes junior, community, 2-year or a 4-year college, university, or graduate school, regardless of whether a high school diploma or equivalent certificate is required. For this exemption, some of the acceptable verifications may include client statement, unless questionable. In that case, may need proof of enrollment from school or collateral contact with the institution. And for our last two examples, we have Jasmine, who is 21 years old. She is enrolled in a community college, and she is taking 9 units, which meets the half-time eligibility. So she is also exempt from work registration. And our last one, we have Kevin, who is age 24. He attends university and is taking 15 units, which is full-time, and therefore he is exempt based on being a full-time student. And going forward, we will transition now to some other work registration provisions. Some individuals may experience a change in circumstances after initial application or recertification that may require them to be registered for work. The registration will depend on whether the changes are subject to the SAR reporting requirements or not. On changes subject to SAR reporting, unless otherwise exempt, the individual must be registered for work at the time the change is reported during the mandatory mid-period reports, SAR 7, and at recertification, any verified voluntary reports, or information that is considered verified upon receipt VER. For reported changes not subject to reporting requirements, the individual must be registered for work at the next scheduled recertification unless otherwise exempt. These changes could be voluntary made but not acted upon by the county. Individuals can also be considered work registered for CalFresh purposes If they are registered with substitute programs like General Assistance or General Relief Work Program or Office of Refugee Resettlement OOR program. Individuals who don't comply with substitute programs will need to be registered for work unless eligible for another exemption. And now on to disqualifications. A disqualification is generally applied when a CalFresh work registrant fails to comply with the work registration requirements without a good cause. Individuals may be disqualified if they voluntarily quit from a job that is 30 hours or more per week, or voluntarily decrease the number of hours to less than 30 hours per week, or the weekly earning below $217.50 per week. The CalFresh disqualification period is based on the number of prior non-compliance instances without good cause. The disqualification period begins the first of the month after a timely notice is provided. First disqualification lasts 1 month, second 3 months, and third 6 months. There are 2 ways to end disqualification period. First is to qualify for an exemption, or second, complete the disqualification period and meet work registration requirement. For households of 1, the previously disqualified individual must reapply for CalFresh by completing the application process. For households of 2 or more, the previously disqualified individual may be added back to the existing CalFresh household either upon household's request, during periodic report, or recertification, whichever comes first. Individuals who become non-compliant with work registration requirements may be eligible for good cause. Good cause may be granted when an individual is unable to comply with work rules, such as voluntary quit or reduce work hours due to circumstances beyond their control. The county is responsible for determining whether good cause exists and must document the reason for good cause determination in the case record. Verification is not required unless questionable. Examples of good cause include, but are not limited to, personal illness or illness of a household member requiring the individual's presence, household emergencies, transportation barriers, limited ability to speak, read, or write in English, lack of adequate childcare for children ages 6 through 11, and leaving employment which is unsuitable. Additionally to the existing good cause, the passage of Assembly Bill 2300 grants expansion to good cause for voluntary quit or reduction in work hours. These reasons include leaving a job due to workplace rights violations, or being unable to meet work rules because of unpredictable work hours. An individual's statement of workplace rights violation does not require verification or a citation to a specific law. A full list of workplace rights violations can be found in ACL 23-30. We will briefly cover some noticing requirements. Starting with CalFresh Notice of Work Rules, CF 886, and Oral Explanation. CF 886 must be provided with an oral explanation of work rules to all exempt and non-exempt work registrants. This notice and oral explanation must explain work requirements and exemptions, good cause and how to request it, consequences of non-compliance, and rights and responsibilities. CF 886 and oral explanation must be provided at application and recertification, as well as when an individual newly becomes subject to work rules. Next is CalFresh notice of denial or disqualification for failure to meet general CalFresh work rules, the CF 377.10. It is used to notify the household of work registration noncompliance when an individual fails to meet work registration requirement. It explains reasons for noncompliance, disqualification period, good cause and how to claim it, and it requires a timely and adequate 10-day notice. And now let's try to connect the work registration policy to ABOD policy. Starting with, what is ABOD? Well, it stands for Able-Bodied Adults Without Dependents. It is a time-limited eligibility rule for a specific subgroup. ABOD rules apply to individuals who are ages 18 through 64, who are not disabled, and do not have dependent children under the age 14 in the household, and are not otherwise exempt. ABOD rules limit eligibility to a 3 months of CalFresh in a 36-month period unless individuals are exempt or meet work requirements, which is 80 hours per month of work or another qualifying activity. So both of these policies are federal level policy. And we just learned that work registration is a general work requirement, more like a baseline or a prerequisite for CalFresh participation. It applies to most non-exempt individuals. There is no fixed time limit, and non-compliance with work rules may result in disqualifications or sometimes called sanctions. Whereas the ABOD rule applies to a smaller specific subgroup, and it focuses on time limit, which allows for 3 months of benefits unless individual is meeting participation hours or is exempt. Non-compliance of ABOD will result in loss of eligibility after the time limit is exhausted. And to conclude and put these policies in perspective, I'd like to present a visual overview of how work registrants and ABODs relate. Starting with our largest pool of all CalFresh recipients. From there, we have a subset of CalFresh recipients who are considered work registrants and are required by federal SNAP regulations to be registered for work unless they qualify for an exemption from work registration. Going further down, we have a subset of CalFresh work registrants who are considered ABODs. These are the individuals that did not meet any work registration exemption. And even further down, we have those ABODs who are considered subject to the time limit or non-exempt. And these are the individuals that did not meet an ABOD exemption. So because ABODs are a subset of work registrants, counties must apply work registrations exemptions first and then proceed with ABOD screening. For today's session, we will stop here, but a deep dive into all things ABOT will be discussed in our next session on May 5th. We have also included some resources here for your reference. Here are the resources pertaining to CalFresh work registration. And just a reminder that you will be receiving a copy of the recording and the presentation materials after the webinar today. And now we will be answering questions that were submitted during the webinar. As a reminder, if you have a question, please submit it in the Q&A box. I'm now going to pause for a second to open up the question box for myself. If you could please bear with me for a moment. Okay, and I'm seeing that we do have a lot of questions today, which is great. We do have some of the questions that overlap with other programs like CalWorks and IHSS. So for those questions, we would need to look into further rather than having solid answers on the spot. And maybe similarly for some of the scenario questions, we might not be able to cover all of those. But in any case, we'll go ahead and try to answer as many as we can. Okay. So for the first question, it's asking how will things be observable if interview is done over the phone? And to answer this, so the workers can ask questions to best determine if an exemption applies and can also use any information gathered to make the determination. A visual observation is not required over the phone, but CDSS is also working on resources to provide guidance on phone interviews that should be available soon. Okay. Another question, can people attest a medical condition? So there is no specific verification requirements for work registration exemption for this. And the verifications are not limited to a specific type or a source, and they should follow normal CalFresh verification policy as outlined in our ACIN I-4511 and the I-45-11E. Okay, next question. It says, can you please repeat one more time if verification for physically or mentally unfit for employment is required? Yes, verification is required. Next question. In the example of physically and mentally unfit, Sarah was exempt based on a 6-month back injury. Is the exempt for the full certification period or just for period of unfitness? So she would be exempt for the length of the certification period. Next one, in compliance with CalWorks, does that include people exempt from welfare to work? The statement was participating in, if I heard correctly.
So they must be subject to and participating in welfare to work to be exempt from work registration. Okay, another question. Verification for physically and mentally unfit can be observable for work registration. Is there a policy letter to reference? And again, so there's no specific verification requirements for the work registration exemption, and they're not limited to any specific source. And all this normal CalFresh verification is outlined in the ACIN I-45-11. So there was a question that was asking about if a certificate program is considered a half-time uh, eligible requirement for the students. And yes, if it's a community college program, yes. Okay, next question. What happens when a CalWorks participant becomes sanctioned for non-participation? In that case, they will be reassessed for work registration status and any other exemption. Next question. So for caregiving exemptions, if there are two parents caring for the child under the age 6, only one parent would be exempt on that basis? Yes, this is correct. Only one household member may be exempt due to caring for a dependent child under 6. In regards to having the medical exemption with medical verification, would we exempt a participant for the entire certification period or for the period indicated in the medical verification? So the exemption would last the entire length of the certification period. And the next question, did HR1 change anything for work registrant exemption? No, the HR1 did not change any work registration policy. Okay, next question. Does revised policy states that the child must be included in CalFresh household? So for work registration, the child does not have to be in the household. Okay, next question. Does a person have to be determined to be disabled by Social Security to be used the caring for incapacitated person? And secondary question, does a person have to be paid to receive exemption for caring for incapacitated person? So the incapacitated person does not need to be determined disabled, and the caregiver does not have to be paid or to receive this exemption. Okay, so for this next question, how would you show the county verification of caring for an individual to be exempt of the work requirement? So, assuming this is asking for verification of caring for incapacitated person, in this case, caring for the individual must prevent them from working 30 hours per week, and client statement is sufficient unless questionable. And then similar question, what verifications are needed for caring for incapacitated person? Client statement is again acceptable unless questionable, and it must prevent the working of 30 hours per week. Okay, and then another question, what changed for ABOT exemptions under HR 1? There are quite a few changes to those, and we have released several guidance on that. Please see ACL 25-93 as well as 25-93E and for the ABOT changes. And then we will also cover a lot of the ABOT information in our next webinar on May 5th. Okay, next question. A parent with one child with an absent parent under age 6 can claim the child for work registration exemption. Can the absent parent claim the child for work registration exemption? Is the exemption given to whoever claims it first? So for this one, only one person per household may claim the child under 6 exemption. Okay, next question. For the exemption example of receiving unemployment benefits UIB, if a SAR, if at SAR it is reported that UIB ended, would the exemption carry through the certification period or end at SAR? So if it was reported at SAR 7 that UIB ended, they would need to be reassessed for another work registration exemption. This PowerPoint presentation will be shared after the training, and yes, the webinar recording will be shared along with the PowerPoint presentation after the webinar is complete. Okay, next question. Does the substance abuse treatment program need to be a DAA facility with a sub-G grant? So for this one, the program can be administered either by private, nonprofit, or any other publicly operated community program. Okay, next question. What verification is used to justify the household has applied for unemployment? Is verbal sufficient or will verification of submitted claim be required? So if this information is not known to the county, acceptable verification can include proof of receipt that they have applied for the benefits, like submitted a claim, or proof of a pending application for unemployment benefits. So this one is specifically addressed to Amber. It says, "Hi, Amber. Are college students pursuing a certificate rather than associate or bachelor's degree eligible for an exemption?" And Amber's answer, it says, "Got it. Thank you for the clarification," which was due to previous question. Yes, if they are participating in the certificate program at least half time, they would be eligible. Okay, next question. Can two different households claim the caring for child under 6 exemption? Example, father has CalFresh case and provides care part-time, and mother has a separate case and also provides care part-time. So for this one, only one parent per CalFresh household can claim the exemption. Okay. So next question, would clients who reside in faith-based sober living facilities be considered exempt? So for CalFresh exemption, if they participate in the treatment program that is part of like, it doesn't matter whether it's private, nonprofit, or public, they could be exempt. Now, if they reside in the facility, there's slightly different rules for that for CalFresh, and I cannot remember that off the top of my head, but we can confirm that there is different rules if they live in a facility versus if they just participate in a treatment. So in this case, for work registration, we only care for participation. Okay, and then there's multiple questions asking if these Q&A will be released along with the PowerPoint and the webinar recording. So we will consider releasing these. Thank you for that. Okay, next question. Can wages be looked at on a monthly basis to determine the exemption? For example, if somebody's weekly income fluctuates. So, under semi-annual reporting, we cannot look at wages on monthly basis. They would have to be averaged. Next question, does the applied for or receiving UIB exemption last through the end of certification period, or does it end when they report no longer receiving UIB at SAR 7? So if it's actually reported at SAR 7 that it has ended, then at that time it would have to be taken into consideration and they would have to be reevaluated for an exemption. Okay, so for the next question, it says if a client states that they are self-employed and that they work over 30 hours a week, but they only make a questionable amount, like for example, $100 a month, are they still exempt? So they would have to provide verification of the hours that they claim they are working, whether they are paid or unpaid. They would have to be verified. With the next question, with the student LPIE changes, do we still look at halftime versus more than halftime? So for this one, yeah, the student eligibility rules are separate from work registration. They would still need to be participating at least half-time to be exempt from work reg. Okay, next question. In what situations do you use the federal minimum wage to determine participation versus using hours? As in the client is working part-time, 15 hours per week, making $247.50 and tips $100 weekly. Would we look at their hours or their wage, which is like federal minimum wage? So in this case, either or is fine here. So if they are working 30 hours, then they would automatically like be exempt. We don't care how much they earn. However, if they are earning less than 30 hours, then you look at the amount that they earn. And if they earn over $217.50 per week, then they're also exempt. Just a second, let me refresh here. Okay, so next question. Which has greater precedent? Reduction of 30 hours for work or over the $217.50 per week? So for this one, it would be if they reduce their hours enough that it dropped below $217.50 earning, that would be considerable. That would be considered in violation of the work registration. If they reduce their hours, let's say to 25, but they're still earning $217.50 per week or more, then they're okay. Okay, next question. Will you go over any specific changes coming with HR1 or the One Big Beautiful Bill? So yes, we will discuss the HR1 changes in details on May 5th as they all apply to the ABOD policies during the ABOD 101 webinar. Okay, next question. Is work rule noticing requirement oral and CF 886 required for households that only include household members that are under 16 or over 64? So CWDs are required to provide this consolidated notice, the written and the oral explanation. They need to provide this to all household members to inform work registrants and ABOTs of the work rules. And this includes individuals who are considered mandatory work registrants and who are exempt, as well as ABOTs and exempt ABOTs. Okay, there was a request to provide a link for CF 886. It was dropped in the answered Q&A, and I'm not sure if it's visible. Give me just a second, let me refresh. Okay, so next question. If the CF 886 was provided at recertification and they were exempt at that time, do we need to provide it again if they become mandatory mid-certification. So the written notice must be granted at initial application as well as the recertification, and also at any time that a CalFresh participant becomes newly subject to any work rules. And the notice must also include those individuals, even if they were like exempt from work and community engagement requirement, along with the reason why they were exempt. Okay, so the next question is asking, does the child under 14 need to be living in the household? So this refers to ABOT exemption rather than work registration. And so for ABOT purposes, yes. Okay. Okay, next question. It's asking, are these changes in effect now, or when is the date these changes will come? So these changes, they're not really changes. This is a standard work registration policy, and they are currently in effect. Okay, next question. So a 62-year-old will never be ABOD? So people ages 60 through 64 may be subject to ABOT rules, even though technically they are exempt from work registration. So to answer the question, they can be ABOTs at 62, unless they meet any other exemptions. Just a second, let me refresh. Okay, so another similar question in regards to age 60. So I thought work registration goes up to age 60, but ABOT goes up to 64. If ABOTs are subset of work registrants, how do these two things work together? So yes, this is a great question. And unfortunately, it's not a clean subset any longer with the changes under HR1. So work registration does go up to age 60. However, people ages 60 and 64 through 64 will need to meet either another work registration exemption outside of the age category or meet another ABOT exemption to be exempt from the ABOT rules. Another question. We have to give them an oral explanation of work rules, even if the household is exempt from work registration. So, if the entire household is outside of the ages of work rules, they do not need to be provided any work rules. So, if we're talking about everybody's like over 65, for example, they don't need to be provided that. But if it includes individuals that are subject to work rules, exempt from work rules, then yes, it needs to be provided. Okay, next question. Can I confirm the age windows for the work registrants versus ABOTs? So CalFresh work registration applies to individuals between ages 16 through 59. So at starting age 60, they are exempt. The ABOD time limit requirements applies to individuals between ages of 18 through 64. So, next question. In order to receive CalFresh, applicants have to go through work registration first, then ABOD to determine whether they qualify or not. So, individuals who apply for CalFresh must be screened, yes, by the county for work registration first. If applicable, they won't be then referred to as ABODs, but if no applicable exemptions apply, then they would have to be screened for ABOD exemptions. Okay, and similar question. Not all ABODs are subject to work registration, correct? Because someone who is 64 would be ABOD but not work registrant, correct? Uh, yes, that's correct. So individuals ages 60 through 64 who are exempt from work registration solely due to age can still be subject to ABOD time limit unless they qualify for another work registration exemption or an ABOD exemption. Another question, would the PA 167 still be used as a form of proof of income for self-employed? Unfortunately, we're not familiar with this form. This is probably just a county form. Is there an updated ABOD form that shows the list of exemptions? Yes, all ABOD forms and notices have been updated to be compliant with HR 1. Just a second. Okay, so there's a question asking if comparable workfare needs to be verified monthly. So for this one, we're still exploring how that whole policy will be functioning, and we'll have more information to share later. Okay, so next question. Which exemption should be ended at star 7 or mid-period if a change is reported that no longer qualifies them for exemption? So if CalFresh participant experiences change in their circumstances that impacts their work registration status and it is reported at star 7, um, then CWD must register them for employment or apply another exemption if they're eligible for. Another question. So some of them are ABOD related questions. This one is asking, should we count any ABOD months from another state? Yes, countable months across state lines. Any countable months that have been used in other states during the current 36-month period would be counted in California as well. So at intake, if client is not work registration exempt, is client denied for CalFresh? No, so registrants who do not qualify for an exemptions, they must comply with work registration requirements, rather than automatically be denied. Next question, is there a screener form for general work registration exemptions similar to how CF 377.11E exists for ABOT exemptions? Unfortunately, no, there is no currently similar screening form for work registration. But I believe some of the work registration exemptions are included on the CF 377.11E. Next question, is there a pregnancy exemption? Yes, but that is for ABOD, not work registration. Okay. Next question, is the LPIE list still being used by benefits analysts, or if a person is a student, then LPIE does not matter any longer? So the LPIE list is still being used. So next question. Can you confirm the following? If a client is receiving general assistance, are they automatically exempt from work registration? So the general assistance, if they are work registered through general assistance, then they can potentially be considered work registered for CalFresh. But participation in GA is not necessarily an exemption. Okay, next question. For CalFresh employment and training, how to access these resources and benefits, like training, what type of training can be done? How can they access this training? Tuition costs, is it fully paid? So if you're referring to CalFresh employment and training program, this will be depending on whether the county has opted into CalFresh ENT and will depend on what types of services the county has decided to provide. Okay, next question. Only ABOT exemption changes. Ages goes up to 64. No more exemptions for veterans, homeless, foster youth, and adds exemption for Indians. That is correct. That is for ABOT only. Okay. Okay, next question. How soon do you have to report a change in work registration eligibility? Or just wait until SAR 7 or recertification? So technically, there is no mandatory reporting for work registration purposes. However, changes reported at SAR 7 will be taken into effect, and any household changes should be reported at SAR 7. So next question, what is considered questionable? How will the worker address a client when the verifications are questionable? Okay, so for CalFresh, questionable information refers to any application details that are inconsistent with applicant statements, previous applications, or official records. And when information is deemed questionable, the eligibility worker must request further verification to resolve these discrepancies. And questionable information cannot be the sole reason for denial, but requires confirmation of documents. Okay, next question. So pregnant women will be exempt. They usually have SDI before due date. How about the due date start for SDI? So for ABOD, the pregnancy exemption begins the month of conception and is not dependent on the receipt of SDI. Next question, are there changes to the homeless exemption? So the homeless exemptions under ABOD have been removed under the HR1. Okay. Yeah, there's some suggestions here as well to provide compare and contrast chart for exemptions that will carry over to ABOD from CalFresh work registration. That will be helpful given we're currently awaiting this clarification from Handbook 3.0. Thank you so much for your consideration. For suggestion, we'll take it into consideration. Okay, just a moment. Okay, so there's another ABOD questions asking when is the ABOD Handbook 3.0 coming out? And we're estimating for it to be published by the end of this week. Okay, and well, thank you everyone for submitting so many good questions. We weren't able to get to all of them, so apologies for that. But we will go ahead and wrap up this Q&A session of the webinar. And thank you everyone for taking the time of your day to listen to our presentation and submitting your questions. You will receive an email shortly with the link to the recording and the copy of today's presentation materials. And if you have any additional questions, please send your questions to the CalFresh policy email that should appear on the screen. Could we go to, there you go. So any questions can be submitted to that email. And we once again thank you all so much for your time and enjoy the rest of your day.